Anemia. What is anemia? Anemia is a condition in which the number of red blood cells or the hemoglobin concentration is lower than normal. When the number of red blood cells or the amount of hemoglobin in those cells is low, the body doesn't get enough oxygen. What are 5 symptoms of anemia? 5 common symptoms of anemia are fatigue or tiredness, generalized weakness, shortness of breath, palpitations, pale skin, and dizziness or lightheadedness. What are the causes of anemia? Anemia can be caused by a variety of factors, including iron deficiency, vitamin deficiencies, blood loss, bone marrow problems, chronic diseases, and genetic conditions. Let's discuss it in details. Iron deficiency. This is the most common type of anemia, and occurs when the body doesn't have enough iron to produce hemoglobin, a protein in red blood cells that carries oxygen. Vitamin deficiencies. Deficiencies in vitamins like B12 and folate can also lead to anemia, because these vitamins are essential for red blood cell production. Blood loss. Both acute and chronic blood loss can lead to anemia. This can be due to injuries, heavy menstrual periods, ulcers, and other gastrointestinal issues. Bone marrow problems. Conditions like aplastic anemia or bone marrow diseases can impair the bone marrow's ability to produce red blood cells. Chronic diseases. Certain chronic diseases like kidney disease, cancer, and autoimmune disorders can affect red blood cell production or lead to increased destruction of red blood cells. Genetic conditions. Inherited disorders like sickle cell anemia and thalassemia can cause the body to produce abnormal red blood cells or hemoglobin.